Hi, my name is Dr Olivia James. I'm from Australian Veterinary Equine Dentistry and also the Veterinary Dental Company. So I'm really pleased to be here today. Thank you so much for Horse Hub Pro and also to Equitana to inviting me to come along and speak with you about equine dentistry. Equine dentistry is absolutely my passion, and I'm hoping that with this presentation I can share some of my passion about this extremely interesting subject with you. Okay, so today we are going to be talking about oral and dental disease of the horse. Okay, so this is a horse's skull. So when most people think about horse teeth, they think about the teeth at the front, the incisors, and they think about the cheek teeth. Commonly people will call these molars, but they're actually made up of premolars as well as molars. So when we open the mouth, what we can see inside is really just the clinical crown, and it's actually just like the tip of the iceberg. So we can see here that is the clinical crown, but if we take away the bone, and this horse is aged about about 5 years of age, which is when their teeth are the longest, you can see up here, these teeth actually extend well into the inside of the head. So these teeth here at the front are encased within bone, and then the teeth here at the back are actually within the sinuses. So they're much, much bigger than people think. Horses have hypsodont teeth, which means that they will continually erupt throughout their lifetime. And that it has, been designed because they eat extremely fibrous foodstuff. So if you've ever chewed on a blade of grass, you will realize just how tough grass is, even though if it's green and soft and lush, it's actually really, really fibrous. So it's very hard on the teeth, and it causes the dental tissue to wear away. Therefore, the hypsodont teeth are designed to keep erupting into the mouth to replace the tooth that is lost away, so they still have their crown to chew on. When people think of dental disease in the horse, they think of the horse pictured here on the left that has an extremely low body condition score. You can see the individual ribs very clearly. You can see the dorsal spinous processes being, very visible and easily felt on this poor old horse. This is what happens with really bad end-stage dental disease. The most common symptom of dental disease in the horse is absolutely nothing. Horses are prey animals. They don't show pain. I've had horses with fractured jaws, fractured teeth, horrific pain. They don't stop eating. They just keep going. They might be a little bit slower and they might drop food, but one of the things that I wanted to let you guys know is the most common symptom of dental disease in the horse is absolutely nothing. Again, here on the right-hand side, this is a grey horse that has a melanoma in its parotid salivary duct. So that's another thing that we might pick up on the external head exam. Then we go over to this old fella who actually has a sarcoid on the end of his nose. So that had been slowly growing and then all of a sudden got big really quickly. And that was, that's just part of doing the external head exam and part of the clinical examination. Then we move on to things that are more obvious, so lumps and bumps. So this fellow had a infection of the tooth, so we would commonly call it a tooth root infection, even though that's not strictly 100% accurate. Apical infection is the more accepted term, and that is when a tooth has died and it has got infected and the pus has to go somewhere, and pus is really, really destructive. It will eat bone, and so the pus that is produced from the dead tooth in this horse has eaten away the bone surrounding the tooth, and it is about to erupt out of the side of the face. Again, similarly, this is a different horse with a lump on the other side, and these are really extreme cases. We would maybe see only 5% of really severe dental disease presenting this way, so reasonably uncommon, but a rather large lump on the face that has then erupted into a discharging sinus, because the pus has to go somewhere, and again, it's really destructive. It can eat its way through soft tissue and eat its way through bone.